Hi, as we continue on today, the most fascinating, miraculous case I've had for a long time agreed to come and see us today. This handsome young man, Jerry Cordova.
Yeah. Jerry Cordova.
Cordova. Jerry came to see me months ago. Been to all kind of doctors, trying all kind of treatments, kept losing his balance. Okay, gave him some adjustments, helped him a little bit, kept him going. I said, Jerry, you got something in your neck. There's something going on. Well, they said I have MS. You don't know. And they couldn't figure out what happened or why he was having it. Man, you on drugs? Something wrong with you? What's going on? We can't find anything.
Took him 10 months to figure out my situation. And the reason was because I didn't have any pain. No pain. They couldn't figure out what was wrong with me. So after 10 months, it ended up emergency surgery with herniated disc in between C3 and C4 of my neck. And it was an emergency surgery, and there was no choice. I either had to do the surgery, or I would be quadriplegic, or I would probably pass. And these were some of the things that some of the doctors had told me, that if I wasn't careful, that I would have some real big problems. And it took my right side. It caused me heat in my left leg. It started coming to my left side, weakness. And then eventually I couldn't walk. And then, of course, it's history after that. And now that I've been visiting Dr. Vetanze and doing acupuncture with Dr. Vetanze's office as well, they got me to work. My right side's working again. I'm moving. I'm functioning. I'm a lot happier. And I'm very grateful for this place. So Dr. Vetanze definitely and Dr. Edward have worked with me, and I know they love me, and I know that I love them for what they've done for me in my life. And I feel like they've given me a second chance to be able to be whole again.
Wow. Very interesting case. He got referred from the gym because this man wouldn't give up. He's working out every day, but he can't walk. He's losing his balance. He's wobbling. Of course, weakness. We do our differential diagnosis. We do our examination. We do the nerve test. Some finding here, this finding here, loss of reflex here, loss of balance, closing the eyes, different. I check his medical records, talk to the surgeon, we don't know, can't find anything. You had MRIs, didn't you? Didn't show anything?
2 MRIs. The first MRI, they just checked for stroke. Second MRI, they figured it out. They seen that it was in my neck.
How big was this thing?
It was a very big herniated disc. The doctor said that it was the biggest one he's seen in a long time, and he couldn't believe that I was still standing.
It obliterated the spinal cord.
It squeezed it. It squeezed it to where it took this right side.
So, I don't see or hear from him for a while. We helped him. Did some activator, did some cervical decompression, adjusted the neck. As long as I adjusted the neck without any pain, we did it. Balanced his pelvis, but it just kept getting worse. He comes in some months later, either walker or wheelchair, wasn't it?
I was in the cane.
Cane.
I had already got off the walker. I was out of the chair. I was so determined. And my willpower just said, I'm not going to be in a wheelchair. I'm not going to be in a walker. So I stood with the cane for a while and got rid of the cane. And now I'm walking without a cane and walking on my own. And I'm going to stay on my own 2 feet.
When he walked in here that first day, post-surgery, he had to have assistance with your son.
Yes.
Jerry couldn't take a step. Jerry couldn't get on the table by himself. Jerry couldn't raise his leg. Jerry couldn't make a turn.
No.
All right. Doc, can you help me?
Because no other doctor.
And I looked, Lord, help me. Yeah, Jerry, we can help you.
God.
So, I knew I couldn't adjust the neck. Get that straight, everybody. When they have surgery like this, you're done with the neck, okay?
Yes.
But I said, Jerry, lay face down. Let me see what else. So when he laid face down, I think
the right leg was 3 inches shorter.
3 inches shorter than the left.
So that's where my balance was.
So I figured, although I'm not going to effectively do the loss of nerve, which is causing the discoordination, uncoordination, weakness, but my God, the guy's having a hard enough time now from the surgery and the loss of use. 3 inches? 3 inches, okay? So every step he took, he's falling down. So I laid him face down. I'm not going to adjust him today. We're just going to talk, okay? Right. I laid him face down because he's doing great.
I'm doing excellent.
Balanced out the pelvis, slammed over the sacrum, tailbone way off, pelvis way anterior, like unbelievable. The shock, stress, whatever reaction he had from the surgery, from a release of energy, from the paralysis, whatever, right?
Paralysis caused me not to move, so it just froze up this whole side and everything was just curling in. And it was hard for me to stretch everything out just to walk, and once you adjusted me, that's when I was able to walk out of here better. You seen
the first day.
You seen me leave here better.
Right. So he had what, 3 or 4?
4.
4 adjustments. He walking good.
And then he suggested Dr. Edward.
Now here's about this.
Yes.
Okay? His energy flow shut down. We talked about the spinal cord, freeing all the nerve energy to heal. Well, I can't go to the site. With my hands, I can't go. I can do a bunch of therapy, lasers, but
electromagnetic.
We did electromagnetic and everything, okay, to rejuvenate the cells. And it works. Electromagnetic frequency, period. So I sent him to my acupuncture, Dr. Edward Kokoloff.
And I've been seeing him 3 months now.
The results have been miraculous.
Yes, they have been. Very much so.
He walks without a limp. He can come through here and walk in a straight line like this. I'm like never he could.
I couldn't before.
So today, when he was leaving after his acupuncture treatment, I pulled up and says, Doc, give me your right hand. He got his strength back. And this guy was supposed to be a quadriplegic.
Exactly. They diagnosed me with tetraplegia because I got something going on all 4 limbs. So they diagnosed it as tetraplegia, and they told me that it would be 9 months to 2 years whether I would know whether it would be permanent damage or whether it would eventually go away. But they couldn't give me no specifics. So that's why I came here for help. And I've gotten all the help that I needed here mentally and physically, and I would recommend anybody to come here if they have any issues, mental or physical.
I got a call from a center, a Chanda, who was injured and shot and is in a wheelchair. She says, Dr. Vetanze, can you ever get any of these athletes you take care of to come up to the facility because they're all depressed? They have quads or complete or paraplegic or tetraplegic, and they're in wheelchairs and they're all bummed out.
And they're depressed. I was depressed for months.
What Jerry says
crying
is we motivated him.
Yes.
We gave him faith, upbeat.
In myself.
We're not going to send him out of here.
Showed me the path to getting well, to getting better, to using my head to say, hey, I'm going to fight this and I'm going to do everything I can and keep going forward and not let this stop me. And with their help, I'm there. I'm not 100%, but I will be.
When I tell you, invest in your practice, get the pulse electromagnetic field machine, get the Simulcare with the multiple therapy device that rejuvenates the nerves, get an acupuncturist or make sure you use one, get an activation muscle guy, put money in your practice, build a multiple disciplinary practice. When Jerry comes in your office, you can do something for him.
Yes.
But other than that, if you're just going to be trying to straighten his cervical curve or correct it, that ain't going to happen. If you're just doing atlas adjustments, that ain't going to happen. If you're laying him on a non-drop table, you ain't going to get that leg to shorten up because his sacrum was so far out I had to clunk it in. That ain't going to happen. If you don't know how to adjust extremities, talk to Kevin Herron, go to seminars, go to Herron seminars, go to Mitch Malley seminars, learn how to adjust the balance of the spine. Have a multiple disciplinary practice. Don't be afraid to spend a few bucks. Not only does it come back in monetary rewards, but spiritual gratitude rewards, because you're doing something good for the universe. These are your all brothers and sisters.
There's a lot of love here. I love Dr. Vetanze. I love Dr. Edward. And I know they love me as much because they took the time to help me, help myself get out of this. And no one knows how this happened. I didn't get in an accident, never had no sports injury, never had any work injury, no injury of any kind. All of a sudden, just one day, I started getting weak. One day I had to quit work, and one day I wasn't working. And I just had to do something to keep myself going because I wasn't gonna, I got a family. I love my family. My sons, my daughter, my wife. I gotta live for them and for myself. And I got to keep fighting. I'm going to do the fight until the end. With any of these conditions, all of a sudden you start feeling all this stuff, and doctors tell you that you're nuts, and you're not. So pain's not associated with any of this. It was just all paralysis, heat.
So they told you you're a hypochondriac, right?
They told me I was a hypochondriac on top of that. So there's a lot of people out there that ain't getting help because doctors stop and say, don't go to a chiropractor. They're not going to be able to help you. They're wrong. 100% wrong. Especially with my case.
Yeah, the doctor said, don't go to a chiropractor. And I said, who is it, Jerry? And he told me, he says, does he know me? No. I mean, what kind of doctor in his heart who took a Hippocratic oath to love, serve, and protect and cure people would say, I don't know that guy, but don't go to him?
Exactly.
What the hell?
There's something wrong with that, and it's not right. And after surgery, I still made the choice to come back here, even though they gave me the advice not to, because I knew you were here to help me.
And now he's going to go back and show him.
Yep, I am going to go back and show them.
Good.
Definitely. Especially when I'm 100%.
They're already going to be freaked out. You're as good as you are, buddy. God bless you. Thank you, Jerry.
Thank you.
Thanks,
Dr.
everybody.